Hello, friends. How are you doing? Welcome to the YouTube channel Health Q, place where our mission is to motivate you to look at the brighter side of the health. As always, I'm your host, physiotherapist Meghana. And first of all, before starting today's streaming, I would like to apologize. Extremely sorry for not being present yesterday as I promised. The reason being the internet connectivity issue. Our internet was not working that great, and that was the reason the live session could not happen. So, as promised, I'm here today to answer all your health related queries. So, we'll wait for 10 minutes for people to join in, and then we will start our live Q&A session. So, feel free to ask all the questions that you have related to your health. Hello, friends. Let's start. At today's Q&A session. And also, I would like to know how you're finding this Q&A session. Is it helpful or not? If yes, then what I would be doing in upcoming week, because I think the lockdown might extend. So we will have this more conversation so that you can interact with me one on one and solve your health problems. My mission with this YouTube live session is to help you sort out all the questions that you have related to your health, that I can care disorders, because that's the domain where I practice into, and I've got 10 years of experience in this practice. So hopefully I will be able to help you in any possible way. So feel free to post your questions. um, Upcoming weeks, I'm working on some content on cerebral palsy as well as Bell's palsy. I know a lot of people out there are looking for answers related to Bell's palsy, so I would try to comprise, comprehend, and do this live session where I'll be talking more about those. So if you don't have any specific questions today, what I can do is today I can talk about kids who are suffering from cerebral palsy or else are suffering from spastic diplegia or any kind of that problem. I understand. I have been treating patients who, or else kids who are suffering from cerebral palsy or spastic diplegia, and I understand being a parent how difficult it is to deal with the situation, and there are a lot of challenges that you would face related to this problem. And I will try my best to help you out in all the possible things that I can help you out in reducing those challenges. So if we'll just wait and see if any questions are arising. If not, then I will just go ahead with today. I have just comprised some notes. So I was going through some research articles and I have made some information around cerebral palsy and spastic diplegia. So I would like to talk a bit more about that. So let's start with cerebral palsy. Or else, if your child is having cerebral palsy or spastic diplegia, you might get confused whether my child is cerebral palsy child or else a spastic diplegia child. Now, these two terms, although are different, but actually come under the category of cerebral palsy, which means that if your child is having spastic diplegia, means that your child is having cerebral palsy. But it is not necessary that if your child is having cerebral palsy, he would be spastic diplegic. That is not true. But a spastic diplegic child is for sure a cerebral palsy child. Now, what exactly is cerebral palsy? So, as the term suggests, cerebral means brain and palsy means paralysis. So, very obviously, whenever there is paralysis or weakness of the body due to damage to the brain, then it is called as cerebral palsy. Now, cerebral palsy happens when a child meets with a brain injury, which can happen before birth, during birth, or after birth. Before birth means whenever the mother is having some pre-existing condition, or else some infections, diabetes, or some other health problem that impacts or else reduces the blood supply, adequate blood supply to the brain. At that time, the damage happens to the brain of the child, and the child will develop cerebral palsy in future. Second scenario, if a mother is giving birth to a premature child or as underweight child, at that time also the chances of development of cerebral palsy is much higher. The another reason that could lead to cerebral palsy during the time of birth is injury that happens to the brain while the process of birth. Like for example, if a child is undergoing forceps delivery. So what happens in forceps delivery? The head of the baby is stuck in the pelvis of the mother, right? Now it's not able to come out. At that time, what doctors need to do? They need to put in forceps to bring the child outside the womb. This sometimes leads to damage to the brain and leads to the complication of cerebral palsy. The third thing that happens is the damage that happens to the brain post birth. Now, post birth, the damage that happens could be due to, again, one, prematurity, like premature birth. If your baby is low birth weight, low birth weight, if your baby is also having some other health issues like hydrocephalus is there, or else he develops some brain seizures, some brain infections. On those time also, the brain damage leads to cerebral palsy. Now, cerebral palsy is classified in many forms. There are many types of cerebral palsy. So, what I will try to make you understand is based the areas of the body that has been affected. So, that's more simpler. So, let's first talk about that. Cerebral palsy, one kind of cerebral palsy could be a quadriplegic child, which means there is paralysis or else paresis or weakness of both the hands and both the legs. That's very common. The second common paralysis is the hemiplegia, which means one side of the body is affected compared to other side. That's the second one. Third format is monoplegia, which means only one hand is paralyzed, rest of other body is normal. And fourth format is spastic diplegia, in which the hand is comparatively less affected, but the legs are severely affected. So the spasticity or paralysis or weakness is present in both the legs. Now, spastic diplegia is more common form of cerebral palsy compared to any other form of cerebral palsy. Yes, quadriplegic kids are also there, even hemiplegic kids are also there, and monoplegic kids are also there. But if you look at the terms of frequency or more commonity, then spastic diplegia cases would be more. I hope this much is clear. So now you got this with by the on the basis of the area involved. Now, based on the muscle tone, right? So the basic characteristic of cerebral palsy child is abnormal muscle tone, muscle tension. This tension that's present in the muscle is altered, and it could be of different kind. So the one and the most commonest form is spasticity. Spasticity means the tone in the muscle is much more higher compared to the normal muscle tone. Sometimes there is sometimes some kind of cerebral palsy cases are there, which is called as dystonic, which means it's difficult to identify where exactly the spasticity is. Both group of muscles show spasticity in a spontaneous way. Third is mixed. Mixed is where some group of muscles would be spastic and some group of muscles would be absolutely weak and floppy, and there wouldn't be any other muscle strength present. So that's the third format. Fourth format is ataxic. So ataxic means there is shivering movement or tremors kind of movement is present in the baby. So whenever a baby tries to move a hand or else walk around, what happens? He will be tremoring or else he will find difficult to stabilize that movement. So broadly, these are the types of cerebral palsy. I hope any questions, guys, you have, you can please feel free to post while I'm talking. And please say hello to me so I'll get to know who all are there online right now watching my videos. And I'm just talking about this thing because the questions are not there right now. So I thought, meanwhile, I'll just talk about some of the information that I have related to cerebral palsy that can help you out. Because upcoming weeks, I would be talking specifically about cerebral palsy and spastic diplegia. So I would like you all to know about that. So that's why. Meanwhile, if you have any questions related to your back pain, knee pain, neck pain, shoulder pain, anything, you can post it right now. Okay, so let's continue by then. So these were the types of cerebral palsy. Now, how the cerebral palsy diagnosis is made. Now, many times parents call me and ask me whether my child would be able to walk or not. Now, initially, it's also difficult to diagnose a child and say this is a cerebral palsy child. This is only the treatment is decided, and then it can be anticipated how fast a baby will be walking and all. So diagnosis is very important. So one diagnosis of cerebral palsy is done is first when there is a history of premature birth, or else damage to the brain of the baby during birth, or else before birth, or else mother having some sort of health issues, then there is more chances of diagnosis of cerebral palsy. And if post birth, if the child is having some sort of health concern, some sort of health neurological related health problem or condition or else a disease, at that time it is diagnosed as cerebral palsy. So one is the history. Second is the signs and symptoms of cerebral palsy. Okay, so there is someone, Mr. Salim Sheikh is there. Hello, Mr. Salim. If you have got any question related to your health or somebody in your family, feel free to ask me. I'm here to help you. Yeah. So, meanwhile, I'll just continue talking. So, in cerebral palsy, the second thing is the clinical presentation, how the child shows. So, there are some classic signs of cerebral palsy, and the first is the delayed developmental milestones. You would have seen a normal child, right? There are some patterns that a child have of growth. Sometimes a child will first start lifting the head, then he will start rolling around, then he will start coming to all four position, then the child starts crawling, then child starts sitting, then child starts standing, and then child starts walking, right? So this is a normal pattern that is existing in our development. In cerebral palsy, this pattern is altered, and when a child shows this altered pattern and delay in showing the presence of the milestone, at that time the diagnosis of cerebral palsy is made. Okay, so we have a question today. Ma'am, by today 1 month or I'm not still completely cured from Bell's palsy, what to do? uh, 1 month from the Bell's palsy episode, right? So, Mr. Pawan, it please give time to 3 months. Usually, 3 months is the normal time for the Bell's palsy to recover. Please continue your medication whatever your doctor has given, and be gentle on your exercises. Do not overdo exercises, because if you overdo it, it might impact your overall recovery. So please be patient and just focus on the areas where you feel that the movements are limited. So just do focus on that, you will be fine. Miss Rosie is there. Hello, Rosie. Hello, doc. I have twitching eye. Do you have some advice, some home remedy preventing eye twitching? Clinic here still closed because of COVID-19. Yes, Rosie, clinics are still closed here as well. Twitching, I do not go with, usually don't go with any kind of home remedies. But what I can suggest is you can give some amount of time of patching to your eyes. Usually relaxation is required whenever there is more stress around your face and all, or sorry, if there is more stress around you, the twitching activity increases. So what you need to do is do some gentle massage for your face, do some gentle stretching to your face, and if you want, if you can observe some twitching happening in particular area, just tape it around the eye. That gives some extra weight to that area and just prevent some unnecessary movements, or else it becomes hard for those muscles to relax, to twitch. Okay, so that is something that I can tell you, but this definitely needs a proper diagnosis, and then only the treatment can be done ahead. So don't worry, twitching are sometimes normal, but just keep and watch that this twitching is not increasing. If it is increasing day by day and if it is spreading, then it is something of worry or concern, and then you need to see a neuro physician for sure. I hope that answers, Rosie. Yeah. So meanwhile, I'll continue talking about cerebral palsy. So we spoke about history, we spoke about physical clinical presentation, and we will just now talk about some of the diagnostic procedures that are done. Right. So for the diagnosis of cerebral palsy, usually no particular test is required, but usually EEG and CT scan or else an MRI scan is done for the child to understand what area of brain has been affected. That's the common thing that is done. Second thing, the treatment is long term. It is never short term, right? So if you are seeing a doctor when your child or else your baby is 3 months old, what he or she will tell you will vary drastically when you see that same doctor when your child is 6 months old, when your child is 1 year old, when your child is 2 year old, right? So many a times people ask me, please suggest some exercises that we can do. It's really difficult to just describe some exercises and just make your child to do it, because every child is different groups of muscles are impacted and are involved, and the treatment is required or else needs to be determined accordingly. Yes, if you are a parent, it is very good idea and it is very important that you become the you also put some effort from your end, because you are the best therapist for your kid. And I can tell you by experience, the way as a mother you understand your child, a therapist cannot. And you have to work as a team, you have to build as a team where you are the observer and you bring all the observation of your child to the knowledge of a therapist, and then therapist will guide you and show you the directions where you need to work. So you need to collaborate together, find out or else list down some of the major goals that you want to achieve, and then work towards it in a collaboration. So that's the best form of method that you can use in order to achieve maximum results. Okay, so Mr. Salim Sheikh is asking, ma'am, मेरा बेल्स palsy 10% सेट नहीं हुआ है, आई एम शोइंग नॉट माई टीथ फुली. मिस्टर सलीम, अगर ये बात है तो आपको आपके जो अपर लिप्स के साइड वाला जो एरिया है, ये और ये, इस पे काम करने की ज़्यादा ज़रूरत है. इस एक्सरसाइज को आप थोड़ा और बढ़ा दीजिए, और हो सके तो इसमें आप इस साइड को रेजिस्टेंस दें और इस साइड से मूवमेंट को असिस्ट करें, इससे असिस्ट करें. इस तरीके की आपको प्रैक्टिस करनी पड़ेगी, ये आपको हेल्पफुल रहेंगी. Mr. Dhanu has asked something. Hi, ma'am. I had Bell's palsy in November. My mouth is back to normal, but my left eye looks bigger than the right. I haven't taken any medication other than the initial antibiotics. Your exercise video helped me a lot. Thanks. Thanks, Dhanu. So, if your eyes are looking bigger compared to normal, maybe it could be because of the atrophy that is developed around the eye muscles. What I can suggest you, please continue doing your eye movements on a regular basis. What that will do is that will help to build some muscle girth around your eye muscles, and then it will become normal. You don't need to take any medications as of such for this. It would be absolutely fine with this. Yeah, I hope this answers your question. Okay, guys, any cerebral palsy related questions you have? Anybody in the group or as viewers who are having any issue related to your cerebral palsy child? Please feel free to ask me. 6 months हो रही है मैम, रिजल्ट होगा क्या? मिस्टर सलीम, ये बहुत डिफिकल्ट है कहना कि रिजल्ट होगा क्या. हर इंसान अलग होता है, आप एक इंसान में रिजल्ट देखते हो, ऐसा ज़रूरी नहीं होता कि दूसरे इंसान में भी वो सेम का सेम रिजल्ट हो, क्योंकि रिजल्ट कभी हमारे हाथ में नहीं होता। हमारे हाथ में होता है वो है कोशिश करना, और इंसान ने हमेशा कोशिश करते रहनी चाहिए, क्योंकि जब आप रिपीटेडली कोशिश करोगे, कुछ नहीं से there's one more question. My left leg locked and I'm unable to bend this. How can I sort this? It happens from last 5 days without injury. Okay, so this is a very good question. So locking of the knee joint basically happens when your muscles are not moving in the rhythm. What is this rhythm, right? So there is something called as your kneecap bone, which lies here like this. Okay, and this moves up and down whenever you are bending your leg up and down, right? So this is your, so whenever this movement is not happening smooth, at that time locking happens. Second reason is weakness of your ligaments, right? So for, in order to find out ligament injury is there or not, that's the second thing. What you can do the best is right now, please buy a kneecap. Any medical store you will get a kneecap, wear that kneecap, and use that kneecap whenever you are standing or walking. That will reduce your locking symptoms. Okay, so Mr. Nami, thank you so much. Yes, that answers my question. What do you mean by eye movement exercise? So Danu, you have seen my video 21 exercises. In that, I've shown some exercises that is done around the eye region. This is there, closing the eyes tightly, and repeatedly, and that increases the girth and helps you to bring that asymmetry together. Yeah, hopefully that answers. Okay, सलीम इस टाइम तुम्हारे वीडियोस मेरे को फुल हेल्प करेंगी मैम, थैंक यू, वेलकम वेलकम सर. Okay, so let me continue till then for cerebral palsy. So yes, where I meant, we spoke about what is cerebral palsy, what are the symptoms, what are the types, how it is diagnosed, and what parents should do. So I would be talking more about what parents can do at home, especially during the time of this lockdown where you cannot actually go to your physical physiotherapist. So I'll give you some tips and tricks and some ideas that you can use for yourself at home to help your child combat with cerebral palsy issues. So stay tuned with me and make sure to share my channel's link with all the people you feel that my content will be helpful for. Because my mission is to make sure that you stay motivated while dealing your health issues. I know there are many other healthcare professionals who are working in forefront to battle with COVID-19. I feel that this is my battlefield place where I know a lot of you are at home and are just not able to go to avail your health services. And I would love to help you out in this time to solve your health problems. So feel free to post any questions that you have related to your health in the comments, or else you can follow me on Instagram. On Instagram you can message me, direct message me. I've also put a link in which I've put my email ID, so you can email me your queries. I would love to answer them. Okay, so Mehraj is asking, doctor prescribe me CBC ESR RF factor. I'm so confused about this. It's first time in my life. See, it's good to go for this test, not a problem at all. It helps you at your home. Please wear that. Extra support and making sure that your kneecap stays in the right place whenever you are moving reduces this locking symptoms for sure. So please do that. I hope that helps. Okay, guys, any other questions? So as I mentioned, I would be creating more content around cerebral palsy in upcoming weeks. So feel free to reach out to me to solve any questions that you have. 1 minute, guys. I'll just put my laptop on charge. It's showing low battery. Yeah. Okay. So Rosie still, I had an appointment with neurologist already, but because of lockdown, I can't go to checkup. Twitching is really bothers me. I understand that, Rosie, but diagnosis is really important. If possible, if you can have a teleconsultation with your doctor and speak about the symptoms, he might suggest you some of the medications to initially lower this down. That is something that you can do. And meanwhile, once this lockdown get over, you can go and meet your doctor. Okay, so Dhanu is saying, thanks, Dhanu. You're doing a great service through YouTube. Thank you so much, Dhanu, for your kind feedback. Anything else, guys, you would like to know? And please let me also know how you're finding these live sessions. Are they helpful or not? I am enjoying this a lot. Interacting with you is feels great. I understand what are your concerns, and it helps me to create better content. I hopefully I can create better content in future. So please keep coming. No other questions now. So let's close this chat session for today. As I mentioned, coming back tomorrow 3 p.m. we will be having another live video session. So feel free to come and we'll discuss some